The G8 commitments to universal access are really critical in order to be able to scale up treatment and prevention throughout the world. UNAIDS estimates that 60% of the cost of scaling up treatment and prevention needs to be provided by G8 countries. So their commitment is extremely important. The problem is that their financial commitments haven't lived up to their political commitments. In 2005, G8 member countries committed to universal access to treatment by the end of 2010. In 2006, all member states of the United Nations, that's all countries around the world, committed to universal access by 2010. The gap in funding at the moment is preventing us from reaching universal access. We're only 2 years away. Unless there's more funding provided by predominantly by the countries that committed, first of all, those are the G8 countries, to universal access, we will never achieve that target by 2010. In the current global financial crisis, there are concerns that richer countries will start to give less money for development overall, for health, for HIV. But in fact, that thinking is completely wrong. In times of economic crisis, we need more investment in the basic foundations for development, health and education specifically. So just as rich countries around the world are now approving stimulus packages to get their economies going, so they also need to give further stimulus to health and to education in poor countries. And so the commitment to universal access to HIV treatment and prevention is just as important, if not more important, during difficult economic times as it is during happy economic times. There are concerns during this global economic crisis that less funds will be made available from rich donor countries to poorer countries for HIV treatment and prevention. But in fact, I believe that in difficult economic times, it's even more important to provide that stimulus for development throughout the world. We're seeing huge stimulus packages from rich countries for their own economies. The same needs to happen for poor economies throughout the world. And HIV/AIDS, dealing with HIV/AIDS and providing basic health care, the basic foundation of health for development, is more important now than it ever was. There are, of course, a whole range of health problems facing people throughout the world, and of course the poorest people in the world face the most health problems. But HIV remains the #1 killer. By scaling up services for HIV and AIDS, what we're seeing is strengthening of healthcare programs overall. So by making HIV treatment available, people coming forward for HIV testing and HIV treatment then gives them access to TB care, gives them access to immunization, vaccinations, gives them access to care for their children, maternal care for pregnant women. So building HIV services throughout the world, particularly in Africa where we are today, is really contributing to strengthening of health systems overall. Since 2002, we've seen a dramatic increase in global financial resources to deal with the HIV and AIDS crisis. The creation of the Global Fund to fight AIDS, TB, and malaria, the creation of the United States President's Emergency Plan for AIDS Relief, or PEPFAR, dramatic increases from private foundations such as the Bill and Melinda Gates Foundation. What we really need to see now is results from those resources, those substantial increases in resources. In this difficult financial time that the world faces, now more than ever, the investment in health, the investment in the future of our people is more critical than ever.